Hi friends, this is Dr. Nyendwa and I will welcome you back to our segment where we talk about things that help us in our daily lives concerning our health. And so today I'm pleased to share with you a common condition known as PID or pelvic inflammatory disease. So pelvic inflammatory disease, this is the inflammation of the reproductive tract starting from the cervix, uterus, ovaries, fallopian tube and the adjacent structures. Okay, so this condition is very common in our ladies in this era. Okay, so I'll briefly talk about what are the risk factors and the causes and what to do if you start seeing some of the signs and symptoms of this condition. Okay, so what are the causes of this condition? The conditions, I would say, there's infectious and non-infectious causes. Okay, so the infectious causes, we've got Neisseria gonorrhea, we've got Chlamydia trachomatis. These are the most common ones, and many others, but these two are the most common ones. Non-infectious causes, I would say, when there is damage to the reproductive tract, maybe during childbirth or during some insertion of IUCD. IUCD is a contraception, or other surgical procedures that can cause damage to the respiratory tract. So these can cause what is known as the pelvic inflammatory disease. Who is at risk of this condition? Number one, the people that are at risk are these younger ones. I like starting with younger ones because that is the future. These younger ones, the age at which they are exposed to sexual activities will risk them. So if they're exposed to sexual activities at an early stage, they'll be at risk of acquiring these microorganisms causing PID. Number two, number of sexual partners. We need to maintain only one sexual partner. We need to maintain one sexual partner, and I'm not saying all of us should go and look for sexual partners. I mean, if we are married, we need to maintain only one sexual partner. And then also, we need to be careful with the number of sexual contact by our sexual partners. Because, for example, I may only have one sexual partner, but my sexual partner has got a lot of sexual contact. So that my partner will put me at risk of acquiring this condition. Also, some practices like polygamy, prostitution will put us at risk of acquiring this condition. And also, some of the common practice that we all do is misuse of antibiotics. So the misuse of antibiotics can predispose you or can put you at risk of PID because antibiotics, you remember, they will disturb the normal flora and they are going to reduce the immunity and expose you to acquiring this condition. So these are some of the risk factors that can lead you to acquiring this condition. Okay, so how would you know that I have this? At what point do you suspect? Number one, these are signs and symptoms that you should look out for if you are sexually active or you have any of the risk factors I've talked about. Number one, you are going to have fever. That's high temperature. Number two, as a lady, you're going to have lower abdominal pain, the pain that is just below your umbilicus. Number three, you're going to be having vaginal discharge that is foul smelling or mucopurulent. Medically, I can say it that, or foul smelling. So if as a lady you have any of these signs and symptoms, what do you need to do? Stop medicating yourself. Stop admitting yourself. Stop diagnosing yourself. You rush to the nearest clinic or hospital, and then they'll help you out there. I know some people feel shy because when they come to hospital, maybe they'll be embarrassed, will start looking at them as if they have got a lot of sexual partners. No, some of these things happen. It may not come from you having an intercourse. It may come from other things I mentioned. Okay, how do you prevent this condition? So prevention of the condition, in other words, is just doing the reverse of the risk factors. So abstinence from sexual activities is the key prevention of this condition. You abstain. If you are married or if you are engaged in these sexual activities, maintain one sexual partner. And also ensure that your partner has got only one sexual partner who is you, to avoid multiple sexual contacts, because it's your partner sometimes that can put you at risk when you yourself you are just okay. So avoid certain practices like polygamy, prostitution, and also hygiene. Ladies, we need to maintain good reproductive or menstrual hygiene. When we have some certain problems affecting our reproductive health, we need to treat them well. We need to address them well, because some of these things may be coming from maybe our mismanagement of certain reproductive health conditions. So we need to maintain that. So ladies, prevention of any condition at whatever level is, I always say this, it's behavioral. It's your behavior. So I've talked about most of the risk factors I'm talking about is because of our behavior, and how we prevent them is because of our behavior. So we can choose to stay away from these conditions or to get ourselves into these conditions. But I encourage you that you follow what we are discussing with you and advising with you from the health point of view, so that you stay free from these conditions. However, in case you have it, you seek medical attention. Otherwise, if you have it and you stay away from medical attention, you are going to face a lot of complications like infertility. You'll be having a lot of other reproductive health problems. Thank you so much, ladies and gentlemen. I've deliberately said gentlemen because we can also educate our sisters, our wives, and everyone around us. Thank you so much. We'll see you again on the next episode. It's been Dr. Nyendwa with you right here.